Hi, my name is Ricardo Rodriguez, and today we're going to talk about lips, specifically augmentation of the lips or whatever to make your lips look better. Well, before we decide what to do to make lips look better, let's look at what a pretty lip looks like. Now, the most distinguishing characteristic of the lip is the cupid's bow. It's that line that goes from here to here on the lip, and it looks like a bow. That's what it's called, cupid's bow, and Cupid, the god of love. And the other one is amazingly constant. It's a distance of 1.1 centimeters from here, the base of the nose, right there, to where the lip changes into the red part. Okay, and that distance is 1.1 centimeters, and I measured it on a woman who was 6'4", and it was 1.1 centimeters, and I measured it on another one who was like 5'4", and it was also 1.1 centimeters. Both of those were done today. It was, you know, incredible, and I guess this is why I'm giving the talk on the lips. But anyways, a pretty lip can be fleshy in some cases, or it can be thin and still be very pretty. If it has those two characteristics of the nice cupid's bow showing some of the front teeth with the short distance, the lip will be attractive, even if it's not very fleshy. Now, how can you tell what you need for your lip? Well, it's a very simple exercise. You can do this right in front of the mirror today and just sort of hold your mouth slightly open like this. Just leave your jaw slack like that. And if you cannot see your upper teeth, forget about lip augmentation. What will happen is the minute you close your mouth, since the upper lip already goes past the teeth, when the teeth meet, it's already overriding a little bit on the lower lip. Now, if you augment the upper lip, it has nowhere to go. It can't push the lower lip down, so it has to go forward. And that's how you get the duck lips. I mean, there's many Hollywood actresses who do those augmentations, wanting to recapture the look of the younger lip. And what happens instead is they end up looking like Daffy Duck or Daisy Duck, as whatever the case may be. Now, I think that some of these actresses, for example, one who might have a long upper lip, even though she's very young, might have benefited from an upper lip lift. Now, the lip lift, it's a great procedure. Now, there are two types of procedures to get the lip lift. The first one is called the gull wing scar, because the scar is right here, right along that line between the lip and the red part of the lip. I don't like it. The reason is that the scar is right there, right in front. And some people can say, well, you know, we'll hide it with a little bit of lipstick, but that doesn't work, because that white line is a very hard to recreate anatomic landmark. When you look at the lip from the side, it has a little bit of a roll, okay? And then when you look at it from the front, that same roll catches the light and gives a white line with a light shines on it, and it creates a very subtle roll in there. And so I like to leave that undisturbed. Besides, you can get a lot of reshaping of the cupid's bow by placing your incision right underneath the nose where it is well hidden. Those scars do great. I have slides of patients at a month and at 4 months, and at a month you can barely see something. When you take the picture at 4 months, you can barely tell anything happened. So the procedure can be done for both males and females. For males, of course, I leave a much longer distance. I leave a distance of about 1.5 centimeters, but it's just a slight turning up of the lip. It just gives the lip a more youthful look. Now, some patients, they have both a long upper lip and it's also very thin. In those cases, you need both things, right? You will lift up your lip, and you'll recreate the cupid's bow, but it may still be very thin and the patient might want to add something. In those cases, I will do a secondary procedure, either adding filler or putting in a little implant. But in any case, I find myself doing a lot of lip lifts on patients who originally come in wanting some filler or saying, I don't want that exaggerated look. And once you explain to the patient what the rationale is, they'll go for the lip lift. I love the procedure. I recommend it. But remember, you may not be a candidate for the lip lift if you're already showing front teeth. If you're showing front teeth already, you'll do great with a filler, and the filler is entirely appropriate. Now, I think that pretty lips are great. I love pretty lips, and I love that we can offer this alternative to many people. Anyways, thank you for listening to the blog again, and looking forward to the next one, and keep the questions coming. It gives me feedback and it gives me ideas, so write any questions you like. Thank you very much.